Welcome to Soul Wellness with Kristen, where we get into the nitty-gritty of various holistic modalities and explore exactly how they help you heal. I'm your host, Kristen, and I invite you to join me on this enlightening expedition where we explore the connection between mind, body, and spirit. In each episode, we'll talk in depth with holistic providers, medical professionals, therapists, and healers. Our goal is to empower you with knowledge, inspire you with stories of resilience, and provide practical tools that you can integrate into your daily life. So, find a comfortable space and join us as we explore the multifaceted world of holistic wellness. Get ready to learn how to improve every aspect of your life and simply feel good. The adventure begins now. Thank you for joining us. Today I am with Linda Ohlandt of Ikeru Massage. Linda is a manual lymphatic drainage therapist, and she is here to tell us all about our lymphatic system. Welcome, Linda.
Thank you so much for having me.
I'm excited to have you here. So you're a licensed massage and bodywork therapist. You do any type of massage, correct?
Correct, yes.
But your specialty is lymphatic drainage therapy.
Yes, it's become lately, yes.
Okay. Perfect. So how in the world did you get into this modality?
Several years back, I was working at a hospital that had an integrative wellness center within it. And that hospital, I had seen a lot of breast cancer patients. And one of the other therapists that was working there at the time, she was certified in manual lymph drainage therapy. And she suggested to me that I should learn it as well because she thought I would like it.
You obviously saw that it was making a major difference in these patients too.
Yes, definitely.
So pre and post-op.
Correct, yes. And even during treatments.
Okay.
Yes.
How is it different than a regular massage?
So we're not working the muscle. Here we're working the lymphatic system. Our lymphatic system sits superficially to the skin surface, so we're using a much lighter touch. We're using either a sweeping, scooping, pumping type motions to move the lymph through the system a little faster.
Okay. And you can actually feel the lymph fluid?
Yes, you can. You can feel it. It feels, its natural consistency is more water-like. If it starts to get congested, it can feel like jello. Then it can feel almost like toothpaste, almost then like Play-Doh, and then it can get fibrotic as well if it's left sitting long enough.
That is so fascinating. So where is it, how is it encased in our system?
It's its own little system. It does intertwine with the circulatory system at some points. Yeah, it's full of lymph nodes, vessels, and capillaries that run throughout our whole body like a chain.
Okay.
It's considered our waste dump.
Okay. So
it's like a sewage system, I should say.
It's how you're detoxifying.
It's part of the detoxifying system. It helps us detoxify as well.
So when you feel lymph that feels thick or like you said, almost like toothpaste or prickly or however you described that, that's your indication that maybe something isn't draining properly in that area?
Correct. Most people have had an injury or a trauma or surgery, radiation, something along those lines that has created that lymph to be that congested for that long that it gets that thick.
So when you're doing this therapy with someone and you feel something unusual that maybe they didn't tell you about, how do you tell them?
I'll ask if my intake normally includes that question. Have you had any previous injuries, traumas, or surgeries?
Okay. Sometimes
people forget it was an accident they had 15 years ago or, a surgery that they had, a knee replacement or something they had years ago. They're not thinking of it, that it can still affect them today.
Oh, wow.
So I'll ask, did you ever have anything here? Was there something that might have been going on, an injury or something? And they'll say, oh, yeah, I forgot about that.
And then as you're working on somebody, you can feel that lymph start to
soften and move
and become normal.
Mm-hmm. Depends on how old it is and how long it's been staying there. Sometimes the system is just a little sluggish in that area, but there are times when it's actually damaged, and that's when that can be a problem. We want to move that lymph to healthier lymph nodes for filtration.
Wow, I can see how this would be really beneficial to work this into your routine of self-care.
Yes, correct. A lot of people like to do this on a seasonal basis, even just once a season to kind of reset their systems a little bit. I've seen people use it on a monthly basis. If they've been exposed to toxins or mold or something along those lines. They feel like it helps keep their immune system running at its optimal best.
Okay. That is so fascinating. What's a normal session?
A normal session is about 60 minutes. If you don't have any particular condition that would require more time and more, sometimes tools, so to speak. We can use some cupping. We can use some gua sha tools, body gua sha tools. There's taping now that's being used for lymphatic work also. So it's pretty interesting.
It is interesting. I would imagine it's probably really important to drink a lot of water after you have one of these.
Most definitely, because we are trying to flush fluids through your system a little faster than normal. And with that is some toxins, some cellular debris that's being removed from our bodies at the same time. So you definitely want to drink some more water and help your body flush it through.
Because you're kicking up some stuff in there.
Yes.
For sure. You have worked on me before, and so I can speak personally to say that it's a very relaxing type of massage. Very light pressure, very, very relaxing. Yeah. Good for your nervous system, I think.
100%, yes. It can be very rhythmic. Well, in your case, you didn't really have any issues or conditions. So for your full body session, it's very light, it's very rhythmic, it is very relaxing. It's great for people with anxiety. It's wonderful for people going through cancer treatment or some other kind of surgery or something else that is very traumatic, because it does help relax the nervous system as well.
Yeah. I will say that I did not drink enough water.
You can get fatigued
after mine, and I'm usually pretty good about that, but I think my mindset is deep pressure massage, and I know that if you get a deep pressure massage, deep tissue massage, you really need to drink a lot of water or you might feel kind of flu-like the next day. Well, the same was true for lymphatic therapy. I did not realize, and I did not drink enough water, and I felt a little flu-like the next day, and I thought, oh my gosh, it worked. She got some stuff moving, and that's actually really good.
Yes. I usually tell people to drink plenty of water like they normally would after any kind of massage bodywork type treatment. Also, I usually tell them not to do anything extreme hot or extreme cold, extreme exercise, any heavy lifting, anything like that. You want your body to basically stay rested, in that rested mode for a little while it's flushing all this fluid out from your body that way.
Okay, that's a great point.
You may find yourself sweating more or urinating more, or even defecating more. It's just part of it.
Part of the detox process.
Yeah. Lymph moves via muscle contraction, so the more you move, the more it moves. So while you're lying there, we're moving it for you instead of your muscle moving it. So it would have almost the same effect.
That is so fascinating. And it's just below the skin.
The lymphatic system sits below the skin. We also have larger, more known lymph nodes throughout our body that are bigger. We have our tonsils, we have our thymus, we have our spleen, we have cisterna chyli, and bone marrow are also lymph node related. Yeah.
So what's your point of view on people that may have had their tonsils out or may have had their spleen out? I feel like this therapy could be actually really beneficial for them because they aren't able to detox properly.
Correct. During any kind of surgery or any kind of trauma to the body, lymph nodes can be removed. The surgeons try not to, but sometimes they are removed. And in those areas, you might find some more congestion in the lymph flow, but it doesn't mean it doesn't flow. It just might be in that particular area. But yes, you have less lymph going through the node's filtration system that normally it would go through. So yeah, it would be beneficial to keep on top of that.
Right. How often do you see somebody that maybe is post-op? And this is any type of surgery, correct?
It can be, yes. It depends on their situation, on their condition, how they're feeling. Depends on their doctor as well. Some people you can see within days of their surgery. Other people, it's 2 to 6 weeks.
Okay.
Is common. Depends if they have drains and such.
And then
what
how
they're
often,
comfortable with.
How often would you see them?
You can see somebody several days in a row. You can see somebody 2 or 3 times a week at the beginning, and then just less as time goes on.
Okay.
Depending on where they're at. It really is very subjective.
I feel like all of the surgeons in this area need to know about you.
Thank you.
I really do, because it's beneficial for pre-op and post-op.
Correct. Yeah, pre-op, it helps prepare the skin for being cut in general. And it's also great for anxiety. People going through surgery or any kind of illness are usually very stressed out.
For sure.
Yeah. So it really helps decrease the anxiety as well.
Okay, so tell me about the benefits post-op.
So after surgery, it helps not only with reducing edema, any kind of swelling, it also helps reduce scar tissue. It helps prevent it from getting too thick.
Okay.
It also helps with range of motion. It increases range of motion, especially to people who've had radiation. That can be pretty intense and pretty tight, especially in the breast because we're protracted. Normally sometimes, some people are very rounded in the shoulders to begin with. And then when you have that radiation in breast tissue, in this chest area, it tends to get very thick there. So we want to break that scar tissue up. We want to loosen that. We want to soften it. Lymphatic drainage helps with that as well. Helps prevent it from getting that thick in the first place. And then if it is that thick, it helps soften it so you do have better range of motion in that area.
Okay. Are there any contraindication? Is there anyone that should not have this type of therapy?
Sure. Anybody who's got a heart failure, kidney, liver failure, any of these conditions, obviously we want those organs to be working well because they're part of the filtration system as well. Anybody who has cellulitis, a DVT, any of these kinds of infections are contraindications as well.
Okay. Can you work on somebody that's pregnant?
Yes, ma'am.
Oh, good.
Mm-hmm.
Very good. And how is that beneficial for somebody that's pregnant?
A lot of pregnant women tend to retain fluid in their lower legs, their ankles and feet. So it helps move that fluid, keep that flushed. Also, it helps with anxiety of you're about to have a baby.
Right.
And, all the unknowns of being a mom.
Yeah.
Mm-hmm.
Do you ever work on people with illnesses like cancer or autoimmune issues?
Definitely cancer and autoimmune disorders as well.
Okay.
A lot of autoimmune disorders create inflammation, and this helps decrease that inflammation. Actually, I think it was 2017 that they discovered lymph vessels in the brain.
Wow.
So research is being done on how lymphatic drainage can help with neurological issues, Parkinson's, stroke, MS, any of those conditions as well. So it'll be fascinating to see what they find, to see if that helps with that as well.
I feel like it's an analogy like when you change the filters in your house or you change the water filters in your refrigerator or whatever. It's just a good, clean detox, helping your body to detox.
Yeah, because it's like our sewage system, so it helps remove all that stuff. And like you said, you want to change that out every now and again. You want to boost that system up.
Make sure it's moving.
Make sure it's flowing freely. Yes.
Right.
Yep.
Right. And I think it's fascinating that you can actually feel if something's going on in a certain area. I think that's really interesting. So you see clients at Soul Wellness. If someone wants to have this type of therapy done, where else do you see clients?
Starting in the summer, you can also find me at the Lymphedema Wellness Center in Cornelius.
Oh, cool. So that's a brand new center that's opening?
It's been open for a while,
Okay.
but I'll be putting in some time there as well.
Okay, great.
Yeah, I'm excited.
That sounds like a great opportunity for you.
Yeah, I'll be working with some other really fantastic lymphedema therapists, so it'll be a lot of fun.
Is there a way to do this that's not manual? Is there another way to do this that is like through machines?
Some people who have lymphedema after surgery will get what's called like a pneumatic pump.
Okay.
I don't know if you've ever seen those, but they're like compression sleeve, a compression arm piece or a leg piece. Some have a full body kind of compression thing.
Okay.
I forget what it's called, but I believe it's referred to as a pneumatic pump.
Okay.
It could be for the one limb that's affected, depending on what the condition with the situation is.
Okay. I was just curious.
Mm-hmm. Other things that can help with your lymphatic system are dry brushing, like I said, gua sha, cupping. There are other things you can do for yourself. Obviously, exercising, rebounding is fantastic. Yoga is fantastic. Swimming is fantastic. Anything that helps you move, that you're exercising, and helps you move your whole body without impact. We're not looking to jar our body. We're looking to physically move it. Even with the rebounding, you don't even have to jump high or hard or land hard. It's not about that. It's just about moving, jiggling. The vibe plate, I don't know if you've ever seen a vibration plate.
I have, and I'm also, now I know what you're talking about, the little, it looks like a little tiny trampoline
The
that
mini
you can
trampoline, yes.
bounce on.
Yep, that's a rebounder, yep.
Okay.
Yep, that's fantastic for it, yeah. Resistance bands, you don't have to work out hard to move your lymph.
Right.
But it is part cardio as well.
Okay.
So it's great for so many different things, just moving your body like that.
Yeah. That's just one more pro exercise. Everybody needs to be out there moving their bodies, for
That's
sure.
Right. Yep.
Very good. Well, tell everybody how to find you. If they do want to book an appointment with you or have a consult with you, how do they find you?
So I am at akroomassage.net, or you can email me. That might be better if you want personal conversation or personal contact. And that would be akroomassage@gmail.com.
And spell that for us.
It's AKERU massage@gmail.com. Or you can even text me. My number is 201-981-5585.
Perfect. And your website is www.akru.
Massage.net.
Okay, perfect. Great. Well, thank you so much for being with us and telling us all about our lymphatic system and
Our unsung hero, the lymphatic system.
how to change the filters.
How to change the filters, right?
I appreciate your time. Thank you.
Thank you so much, Kristen. This was fun.
Thank you for joining us on another enriching episode of Soul Wellness with Kristen. We hope the insights shared today have resonated with you, inspiring a deeper connection to your own journey towards holistic well-being. If you enjoyed today's episode, we invite you to subscribe, share, and reach out. Your feedback fuels our mission to bring you meaningful content that educates, empowers, and uplifts. Remember, you are a vital part of this community, and together we're creating a ripple effect of positive change.